I am Dr. Keila Brown. I am an adult geriatric nurse practitioner, and I am from Madison, Mississippi. So, as a provider, I think some of the most important things starts with the relationship that you build with your patient. That is one of the most key factors in providing high quality care because the patient has to be engaged as well as the provider. Developing a relationship, being relatable, though it may not be an issue you personally deal with, you're able to relate to the patients and make them feel comfortable, making them informed, allowing them to be a part of their care planning process, keeping their socioeconomic status in mind, other social determinants of health. So for me, when speaking with my provider, I like an open, honest conversation. I don't want to be treated as though I'm a provider or as though I'm someone in healthcare. I want to be treated just like she or he treats any other patient. Educate me on what's actually going on with me. Inform me of what my labs are. Do not expect for me to interpret my own lab results because I am a provider, or do not expect for me to review my chart and interpret whatever my image results may be. Provide me with the same respect and courtesy you would do any other patient. For me, healthcare has been pretty accessible. I'm thankful for that. Being able to have commercial insurance, being knowledgeable enough to know what specialists are in the area, and seeking the care that I need based on what's going on with me. Several years ago, I was doing my monthly self-breast exam, and I noticed something abnormal in my left breast. This happened on a Saturday morning. Of course, I was paranoid all weekend. However, Monday morning came, one of the providers in the clinic examined me, reassured me that she felt like it was a cyst, but she was able to go ahead and call and get me an appointment to get a mammogram and an ultrasound done in a timely manner. So as a provider, I try to do the same for my patients because I know how it feels to be concerned about what's going on with you. So going back to one of the original question of what some of the points for providing quality care, I always tell my students, be relatable, be comfortable, and know what you know and what you do not know. Find the answer to it or seek additional help, because the worst thing you want to do is develop a non-trusting relationship with your provider. So that's a big thing for me, is for them just developing those relationships and recognizing the health disparities that we as Black women face. People do not always take a close look at the health disparities faced by Black women, and that's because we are so strong. We keep going. We mask a lot of things that may be going on with our bodies because we're always there for others, and we're not the sole focus of who we are. So when you talk about sex is one of those topics that people really don't want to talk about. That's something that I've had to really work with my colleagues on discussing. During the triage process, the nurse or the medical assistant does ask about the patient's sexual health. They, in most situations, are not comfortable themselves asking those questions. So the questions get skipped, or the wrong answer is marked within the chart. So Again, going back to trust and developing that relationship. So I'm very open. I ask, are you sexually active? Some situations is yes, some situations is no, depending on the patient. So it's my role as the provider to educate them on the advances in HIV treatment over the years. People for so long have looked at HIV in such a negative light because of the stigma that's associated with it. They think, if I don't know, then I don't have to deal with it, which they're doing more harm to themselves than good. Because the earlier you know and the treatment you receive, you're going to live a healthy and prosperous life with the medications that they have come up with these days. Most patients are taking one pill a day and their viral load is suppressed. The marketing is not tailored to Black women. It is either tailored to um, same gender loving males, Black males, white males, and now there's a heavy focus in the Latin American communities. And I don't think there is enough focus on Black women. And the younger Black women are being impacted by HIV more than anything right now. Then we also have to take into account our women over 50 who are being newly diagnosed with HIV because despite your age, people are still having sex. And the older they are, they don't think they need to use a condom. I have patients to tell me all the time, girl, I'm not using a condom. I'm too old for that. You're never too old for that because a lot of them are having sex with younger males. Building a strong relationship with your patient, addressing health disparities, and involving them in their care, meaning involving them in the care plan that you decide is best for their quality of life. When I say building relationships, a patient should be able to trust their provider. They should be able to be honest with their provider. They should feel comfortable when they come into the clinic discussing what may be going on with their bodies. Also, a provider should know their patients well enough to be able to notice when things are different with them, whether it be physically, whether it be from their mental standpoint, from their mental health standpoint. So involving them in their care plan is key because if a patient does not agree with what you may be providing them as far as from a medication, prescribing them from a medication standpoint, or sending them to another specialist, then their likelihood of being compliant and keeping those appointments and being engaged in their care is very slim.